Are you wondering whether private health insurance companies will allow rebates for online health consultations? Hi everyone, how are you going? Karen Finnan here, physiotherapist and Director of Online Physio. Well, an ongoing question that I've had ever since I first started our online physio clinic was around rebates. Now, of course, in Australia, that's do the private health insurance companies allow rebates for the online consultations, but also in a greater sense, does this apply across the world? Can travel health insurance cover online consultations? All of that sort of thing. Very common question that I get. And, for a long time, online consultations simply weren't recognised. But it really seems that in the last 6 to 8 months, there's been a big shift in that. There's starting to be more discussion around rebates for online health consultations, and the private health insurance companies are certainly seeking out more information regarding this. So I thought I would sit down and give you a bit of an update. The Australian Physiotherapy Association recently sat down with a range of people from the different private health insurance companies in Australia to have this dialogue, to open up this discussion about permitting rebates for online consultations. Now, this is going to be a slow work in progress, and I certainly don't expect things to change rapidly overnight. And the APA did a really wonderful job of presenting a case for online consultation. I think it's safe to say that the private health insurers are very early in their understanding of telehealth, the safety of it, what it involves. So I thought I'd just read out a few little dot points of the concerns that the insurance companies had, just to give you an idea of where they're at, and then obviously talk about what we're going to be doing moving forward to help get these rebates for people who need them for these online consultations. So there are a few of the issues that the private health insurers raised. So I'll read them out. This is from the summary email. So there are concerns that the services, the online health services, would not be safe, clinically effective or cost effective. There were concerns that including the service on their schedule would encourage physios to overservice or overcharge for consultations, that there weren't enough physios skilled enough to offer these online consultations, that their policyholders weren't requesting online consultations, and that their wording, that the way that their rebates are worded is that the location of the therapist and the patient has to be the same for that rebate to be available. That to change that would include a lot of technology and re-engineering, and that would be at considerable expense. And that they didn't feel that there was any uniformity, I guess, in the online process. So this shows me it's great to see that they're thinking of these issues. These are probably considerations that I've been dealing with for many years to streamline and make uniform. So hopefully with time we can make them realise that we're actually a lot further developed than they probably think we are. Let's just cover a few of these off again. Services would not be safe, clinically effective or cost effective. So I think there's considerable research now, I know that there's considerable research now showing that online consultations have the same, if not better outcomes than in-person care. And I have, no qualms about feeling confident in the research that's out there. In terms of safety, in the digital space, it's actually very easy to build in safety features to the whole consultation process. There's a 100% record of all that we do. There are disclaimer tick boxes. There's clear wording. So I know hand on heart that online consultations are in fact safer than in-person care because of the ways we can look after the patient in terms of written clauses, written information, understanding and record keeping. Charging for unnecessary services. Look, I think this probably limits your perspective of physios as a whole. I think as a profession, it's a very credible profession, and we certainly want to do what's best for our patients. So I don't think that taking that to the online space would shift that. I don't think that would shift the whole ethical basis of our profession. So hopefully they can work out that that's not going to be the case. Insufficient numbers of physios with the skills to undertake the consultations. Well, it's a very chicken or egg question, isn't it? Because if rebates were available, there would be increased demand for services, increased knowledge of the services for our patients, and therefore more people, more demand. So, it would be natural that physios are upskilled in that. All you need to do is look at the introduction of something new, like say dry needling into our profession, once it's known and the demand is there and the research is there, physios are very happy to very quickly upskill and have more tools in their toolkit. So I don't think that's an issue at all. Policyholders aren't requesting online services. Well, of course, that's because they don't know they're available and they don't know they're rebatable. So again, it's a chicken and egg question. Make them available, and I can guarantee you that with the increased benefits, the increased flexibility of doing an online consult, your members would then be requesting them. In terms of the rebates and the engineering of their systems, that's obviously something that I don't have control over, but obviously something that they need to have the foresight to prepare for moving forward, because like it or not, teleconsults are coming, and these systems will need to be adapted at some point anyway. And then in terms of agreement on the platforms and things that we're using, well, like private practices, face-to-face private practices, they use different practice management softwares, they use different exercise prescription softwares, they even all secure their clinical files in different ways. So a lack of uniformity in online consultations shouldn't be any more a limiting factor than it is for in-person, consultations. Lots of issues there. I hope you found some of those points really interesting. I would love to know your thoughts as well. I've got a really nice little ending to this tale, and that is that in a few weeks I will be personally meeting with some of the people from Medibank to actually discuss in more detail all these things we're talking about. They want to really get down to the grassroots level and see how these teleconsultations are being performed. And so I'll be really happy to go through that with them and show how we've thought through every step of the way, how it's incredibly safe, incredibly effective, and hopefully that will keep this conversation moving forward. Soon, one day, we'll have rebates for our online health consultations through the private health insurers. But in the meantime, one final little tidbit is that it seems that travel health insurance companies in some instances are rebating these online consults. I've recently had an example of that where a chap who's travelling is undergoing rehab post-surgery and his insurance company has covered for his physiotherapy services through online physio. So it's happening, it's creeping, and I'll keep you updated on this space. You guys have a great day. I look forward to chatting to you next time. See you later.